Lines.
Thank you. Thanks, Julian. Can I ask you both, starting with Rich, just to talk us through the actions that your members at your branches have made to your venues to make them COVID safe, and the costs that have been incurred doing that. Rich.
So way back when the pandemic first started, we worked with UK Active to ensure we built guidelines that nested under the gym guidelines. So there's three principal areas of that. The first is social distance, and we agreed a capacity limit of one person for every 9 square meters. And many of the climbing walls have gone beyond that because of the nature of the way our buildings are set up. The second is hygiene, physical hygiene of the environment. So we have guidelines that require our climbing gyms to clean frequent touch points every hour. And then the third is personal hygiene. So we ask our climbing gyms to put hand sanitizer around the place. And a few months ago, we moved to insisting that people wear face coverings when they are not climbing. So even if they are in the climbing area, they must wear a face covering, except when they're climbing upwards or downwards. And the Associated British Climbing Walls has supported that with marketing messages, with posters and social media things that enable the climbing walls to get that message out to their customers. And I think it's fair to say that both the climbing walls and the customers have been incredibly compliant with those measures. So the climbing walls are run by individuals and owned by individuals who naturally want to do the right thing to protect their industry and to protect their customers, who they know personally. And the members are socially responsible people who want to do the right thing to protect their colleagues and friends and people around them. So we've had a really high level of compliance to the range of measures that we've put in place.
Thanks, Rich. And can you give us an idea of the costs incurred typically in an individual operation?
It's very difficult because the operations vary from turning over £150,000 to turning over 5 million. It's been significant because of management time, which is always an intangible thing. The amount of hand sanitizer we get through, the putting up of posters and social media and so on. But the biggest impact on climbing walls is the reduction in revenue because of the capacity cap.
Right.
And that's typically between 20 and 50%. Our capacities can be, between 80 and 50% of what they were a year ago.
Thank you. Rebecca.
Thanks, Damien. Very similar to Rich, we spent a huge amount of time during lockdown 1 really trying to understand the virus, trying to understand the restrictions that the government might look to bring into place. And we worked actually with a team of other operators, partnering with UK Active, involving Public Health England and then Sage to ensure that we'd got some really robust protocols that would ensure that gyms are a safe place to work and also a safe place to work out. You know, your point on investment, well, actually, we've invested north of 5 million into a whole range of different things. So cleaning has been fundamental. So putting in place cleaning stations for our members to be able to use to clean down kit, additional cleaning materials and improved cleaning materials for our staff to be able to clean on a 3-hourly basis. We had to invest in new entry systems, so to enable contactless entry through a QR code for all of our members. We've had to separate kit, and in doing so, we've put barriers, so invested in barriers between kit to ensure the 2-metre separation. And we've also implemented in some of our clubs booking slots, and the booking slots allow our members to be able to book in advance that works alongside our capacity restrictions. And it's important to note about capacity restrictions because in certain clubs, this has meant reducing down by up to 1/3 the number of members that previously we would have had in. during the last 9 months, new protocols have come into place. Rich mentioned face coverings. That's also been the case within gyms as well. So all of our staff have been wearing masks. We've been asking our members to wear masks as well. And I have to say, our members have been absolutely tremendous following the rules. And actually on member surveys across the industry, members have said that they felt a huge amount of investment and that actually gyms have felt really safe to them, a real safe place to work out. And actually, I think our industry data really supports this. And, you would have seen some of that. We have been recording down visits across the sector and case rates that cases that we're aware of from our members on a weekly basis. So since the first lockdown relaxed and we reopened, which was the 25th of July, right through to just after Christmas, the 27th of December, we had 75 million visits across the industry, and actually only had a case rate of 1.7 cases per 100,000. And that's an absolute fraction seen versus society as a whole. And what we've also been recording specifically staff. And I think staff is quite an important measure because, staff are working sort of north of 40 hours a week within our gyms. And, and the rate for staff has been significantly lower than the nation as a whole. So I have to say, I feel really confident in the protocols that we've put in place, the time and effort that we spent working with UK Active to build them, the cash investment that we've had to make into our facilities. But, it has ensured that gyms are a safe place to work and a safe place to work out.
Thank you. And look, I realise it could only be very limited, but what do we know about infection rates and safety since the new, more transmissible variants? Is there really any data that's useful on that at all in the context of gyms?
It's actually very difficult to read, and the reason for that is we had started to lock down various parts of the country as the data was getting collected. And of course, the areas of the country that were starting to get locked down were the areas where that faster passing virus was prevalent. So that's really difficult for us to be able to tell at this stage. But I have to say, I feel very confident that the protocols were right. And that, at the point of reopening, I think we will be able to ensure that, gyms are safe, both for our staff and for our members.
Rebecca, what things do you think from this period you would keep? So if there were no coronavirus, if we look 2 or 3 years hence, God willing, or no coronavirus beyond kind of normal flu rates, of the innovations or the changes you've introduced during this period, which do you think will stay in the industry?
I think there's probably, I can certainly speak for us as, as Pure Gym. I think there's probably 2 things for me. The reality is, I think members will place a different level of importance on hygiene and cleanliness, more than they ever have done before. And therefore, I think it's really important for operators to stand beside that and, and improve the quality of the facilities that they're offering. And, certainly for us, we didn't have member cleaning stations in place before. I'm absolutely confident that they won't leave now. That's something that will be a permanent fixture within our operations. And I think that probably the second one, and you mentioned the word innovation, I think that's really important. I think operators have all had to innovate very, very quickly over the course of the last 9 months. In the past, we'd been looking at contactless entry. So our members being able to get into and out of the club purely by using their mobile phones. We'd looked at it a couple of years prior, hadn't progressed with it. Well, guess what? We managed to implement it within, I think the window was 6 weeks from discussing it to having it rolled out across the estate. And
it's amazing what companies can do when they need to, isn't it? Sometimes.
I tell you what, when you've got to make decisions, make it quickly. You pull together and you really do make a difference.
Thank you. And finally, Rich, can I ask you? Although this question is very relevant to gyms as well. But facilities like yours must have a very sort of uneven demand pattern by time of day and day of week. And we're talking about capacity constraints for safety reasons. So I just wonder, as we come out of this, what potential do you think there is, particularly with, perhaps changing working patterns, more people work from home and so on? What potential is to smooth out that demand to effectively raise your capacity and improve yield?
Well, when you asked what innovations would I keep, the two things I would keep would be the hygiene. I echo what Rebecca said about hygiene. But the other thing I was going to say is home working.
Right.
In the period between the first lockdown and the second lockdown, we saw a huge shift in people's climbing habits. So we had much, much busier daytimes and relatively speaking, quieter evenings. So we spread people out throughout the day. And that enabled a number of climbing walls, probably the majority of them, to reach their capacity caps at their busiest times. So I think anything that to work from home, to work part home, part office, to work from a desk in the corner of the climbing wall or the corner of the gym is a really healthy thing. It's variety for people's lives, and it keeps them mentally fresh and in social environments. So I think keeping home working and encouraging home working is a really valuable thing for many industries like ours, who typically have a busy period from 5 o'clock to 8 o'clock, and their assets are sat doing relatively little for the rest of the time.
Yeah. Thank you, Chairman. I'm done.